Good morning, and can I welcome everyone to today's webinar. Thank you so much for joining us for this webinar on participation and co-production in family hubs using the Lundy model. It's wonderful to see so many of you here this morning. For those of you that don't know, I'm Bez Martin, Head of Participation here at Anna Freud. I'll let my co-host and colleague introduce herself now.
Yeah, good morning. I'm Dina Koschrek, Parent Participation Advisor at the National Center for Family Hubs and an adoptive mom of 2 teenage girls. I'm an expert by experience.
Thanks, Dina. Briefly, for anyone who's joining us today for the first time, the National Centre for Family Hubs is an online resource hub and learning network funded by the Department for Education and led by the Anna Freud Centre. We are the UK's leading evidence-based children and families mental health charity. The National Centre is designed to support the development and implementation of family hubs and to spread best practice across England, taking into account what families say they want and need, and also what providers tell us about best practice and what we know from evidence about what works. Today's webinar is part of a rolling programme of learning events hosted by the National Centre, and recordings and resources from our previous events are available on our website. The aims of today's webinar is briefly to provide an introduction to using the Lundy model in participation and co-production, and to make links with the Lundy model and parent carer panels for family hubs. We will obviously share any resources that we have permission to after this session. You can also join our Family Hubs in Mind learning network to receive our newsletter, where we will share details of any future learning events and resources. I will just hand over back to Dina.
Thanks, Bez. We're joined by a brilliant lineup of speakers this morning to explore this topic. We're going to start with an introduction to the Lundy model by Professor Lundy of Queen's University Belfast and University College Cork. And there will be time for you to ask Professor Lundy questions after her presentation. Our next presentations will then focus on applying the Lundy model in practice, exploring both the successes and the challenges. Firstly, we will have a presentation from Estelle Duffy from Tusla, the Child and Family Agency in Ireland. And following this, we will hear from Varsha Patel and Raki Varia from Leicester City Council.
Thanks, Dina. We will end the session with a Q&A, and you can consider questions for both myself as Head of Participation at Anna Freud, Dina, as she said, the National Centre for Family Hubs Parent Participation Advisor, our speakers from Tusla and Leicester City Council, and also joining for us for the Q&A, we have Anna Bedford, Regional Implementation Advisor for Family Hubs. You can place any questions for the Q&A in the tab, and you can do this at any point throughout the webinar. Just to make you aware that the chat function has been disabled for all attendees, and if you have any issues, you can let the support team know via the Q&A tab in your toolbar. Also, subtitles have been enabled for this event. To make these visible on your screen, please click on the closed caption button on your toolbar. We do have some questions in the chat, so we're going to go straight to them. The first one is more of a request. If we could please share some more information on the infant participation used in Scotland.
Yeah. I think it'd be really helpful to send participants the link to that. They have an infant pledge, and they've taken the 4 concepts and they've looked at it in the concept. The very youngest, it is the idea of babies' rights, because of course the convention applies to all children, and that includes babies. And they just have like some beautiful examples of how that might happen in like health visiting, you know, and from practitioners. And it seemed to me it's essentially really tuned into listening and observing babies and recognizing the way that they express themselves, but also that other element of enabling parents to do that as well, you know. And one of the ways that that's enabled is through really good professional practice. So whenever the adult professional, perhaps it's the health visitor or the social worker, is communicating with the baby, that they're really saying to the parent, oh, look at what she's saying, look at this is happening, oh, we must do that, this is what you mean. And it's really that set of skills, you know, that and it's really modeling that for parents as well and showing parents how to do that. If you want a really nice early example and to give her full credit for this, there's a professor called Priscilla Alderson, again at UCL in London. And Priscilla has written an article called the Participation Rights of Premature Babies. And it was showing that the very youngest children born early have the human right to be heard. And she did a really nice research project where she showed that neonates in an ICU unit in London hospitals, she showed that observation that they were happy, i.e. not crying, whenever lights were low, sounds were quiet, and they had the touch of their parents. And that was expressing that they were content and happy, and that whenever things were very bright, things were very loud, and that they were undergoing procedures, of course, they were crying or distressed. And that doesn't mean to say, of course, that you can't do procedures under bright light, but what it says is where possible, it's really important to keep the conditions in the way that the children would be happy, lights low, really quiet, lots of human touch. So it's a lovely example. And I think the Scottish infant pledge takes that further by taking it just across practice with children, babies.
Thank you. We then have another question that reads, this is so beautiful to hear. However, in my experience, to do this well and meaningfully, we need adequate resource and commitment from the audience, decision makers. Often we work in contexts where both of these are limited or even absent. How do we build the case for this to be funded and take seriously?
So I think there are lots of people in England, in particular, Bez Martin, who are building an incredible case for this, because they're demonstrating it in practice, and they're demonstrating that how effective and useful it is in practice, and shaping that understanding that it's not that added extra, that it has to be done and it has to be costed and staff have to be trained and given time. But, we're not naive. I don't know anyone sitting in the UK at the minute in children's services is naive about the pressures on the system, and particularly pressures for resources. And I think one of the ways, of course, that we do that is to sharing of good practice and understanding that there are some things that can be done that don't necessarily take a lot of time and a lot of additional resource if it's understood how to do them, which is really important that we create those networks, which in fact Bez and others have done, the Lundy network, where they're sharing excellent good practice. And this today, this seminar, you'll hear other examples. But there are so many easy ways. When I'm doing some other myths, one of the things I haven't today, but I show this idea, this conceptual idea that it's really hard, this idea, you can't do these three things at once. You can't be cheap, you can't be good, and you can't be fast. You can only do two of those at any one time. And so I think it really, really works with child participation, because we want child participation always to be good, or good enough, if you take my line. Good enough, that means Lundy Model compliant. But that it can't, cheap and fast, pick one. And we need often your work to be fast, and that can't necessarily be cheap. So I think resources are there and examples are there. And I collect these types of examples. So I think you can share them yourself, of things that are really simple and easy, but are meaningful and really integrated into practice, once staff are trained. But I understand exactly where you're coming from.
Thanks, Laura. We have another question. Would it be possible to say more about Article 5 and how it relates to corporate parents? Am I right in thinking that it places an expectation or duty for corporate parents to provide information in a timely manner to the children and young people they support or interact with?
Yes, you are. Good interpretation. So yeah, the parent guardians includes the corporate parent, of course, it's the same thing. So the same obligation is to provide advice and guidance in the exercise of their rights. And I suppose that is where a little bit of my own work has taken me. I didn't have time today. So it's not just Article 12. The next right to Article 12 is Article 13. And we have it as well. It's exactly the same text, is our right to freedom of expression. But it says that right is not just freedom of expression. Children and we have a right to seek, receive, and impart information. Seek and receive information. So children have a right to seek and receive information. And that was that point, is that very right underpins the realization of other human rights, including the right to be heard. So I think that way of developing really good child-friendly information is where I've been doing a lot of work. I've written a guide for the European Commission and for the of Save the Children International, and we're gathering really good examples of practice there. and involving really, what I really encourage you to do is, if you're providing child, or I would sometimes everyone friendly, because parents and guardians as well, information, is to do that with children themselves, because then you really understand what they need to know and the language in which they will understand it. You know, what I'm training on that, I will say, I quote a Scottish academic who says that the language dilemma is mutual. We think we're making things easy for them, but we actually don't understand the language they use. I'm not even talking about the complications of translation. I'm talking about just cultural context, you know, and the language that children and their families use. So we have to be sure that when we're conveying information, we're conveying it in the ways that they will actually understand, and the information they want to know or need to know, you know. Yeah, really important.
Thank you, Laura. The next question is this framework used in schools in the UK with regard to well-being and children's safeguarding?
Yeah, it is. I mean, I use quite a lot. I would say the UK broadly. Ireland is always the best example of everything, because they were ahead of the game by 10 years. Okay, and there's amazing practice. I mean, the reason I can't stay with you is, for example, that I'm chairing a review at the Irish Ministry for Education, the Department of Education. Education ministers are usually the worst, as they were, but they have decided that because of this obligation, because of the national strategy, because of everything, and because they are the ministry which really engages with children, they are having a review of how they engage children in the work of the Department of Education. Okay, and I'm chairing that, and we're obviously doing that with children and young people, which is the session today, and we're looking for examples of good practice. But in that group, it's a who's who of the education system in Ireland. And there's just amazing practice. In other parts of the UK, Scotland, it's used a lot in Scotland, and the Lundy Model is used a lot in Scotland, not so much in Wales. I think they have their own stuff, which is great. But in England, I think maybe Bez can tell you more through the Lundy network. There are some examples of education, and one really nice one is in Hull. There's a network of schools there. It's an academy trust called the Thrive Trust, and they've really gone for it a big time, and they've adapted it across their schools in, I think, a really respectful way. You know, they're looking at how you do that in educational delivery, and they're doing it with children and young people, and they have little conferences all the time. So if education is your thing, it's the Thrive Trust, and they have their own this is a very good sign of how significant it is to them. They have a person whose job it is, who's the pupil engagement officer. His name is Paul Browning, and it would be really good to look at his work. Yeah.
Thanks, Laura. A comment and question from the chat refers to your feedback form that you shared. What age is the feedback form aimed at, or do practitioners actively support younger children?
Yeah, I think it has to be. I mean, you can't give a written form to children who can't read or write. So I think we've talked about that before. I think that was created with children who were like 10 to 13, and it would work for children probably 9 and above. But I think absolutely a really good question is, I think it's the principles and those statements can be done in different ways and in really playful ways. You know, about, you know, when we go to the end of sessions, we would often do it like a running game or throwing balls, or, you know, if you felt or standing on a spectrum. If it's an individual child, I think there's a way and you can just ask those questions. So I think it's a starting point, but it would have to be adapted for definitely for younger children who do not read or communicate that way. Yeah, for sure.
Thank you, Laura. The next question is, children, you will find, seem to know their rights, but sadly, teachers and parents have reduced rights. Is anything being done for the rights of parents?
Yeah, well, I think that's the work I hope you're going to do, because parents most definitely do have rights, you know, and I think, as I mentioned, you cannot. And teachers have rights too, and parents have rights. I think it's a myth and a misunderstanding that they don't. And the reason they have rights is they're human beings, and human beings have human rights. So children have different rights because of the different position children are in, and that is a position of dependency. And I'm not saying that they're not. There are, of course, some adults who are in a position of dependency, but in terms of parents and teachers, even though they're in positions where they're challenged, they are also rights holders. So if we take teachers, for example, I've written a lot about this because that's my main interest is education. there is this myth that there's this tug of war going on between children and teachers, and it's challenging their autonomy. And if you see it that way, you're going to find the problems. But what you should see it as is, in fact, and this is the way the human rights framework sees it, you cannot deliver children's right to an effective and quality and safe education unless they have teachers who are valued, supported, and have decent morale. It won't happen. Okay, and actually in human rights conventions, not obviously CRC, there is an actual obligation to improve the conditions of teachers. Now, I know that doesn't happen necessarily, but it's still there because there's an understanding they meet. In terms of parents as well, of course, but what parents clearly have rights, they have lots of rights. And one of those rights, as I've said, is to advise and guide. It's a right to be supported by the state in raising their child when there are challenges, you know. Clearly, the rights are not absolute. And some parents might lose their right, for example, to have custody of their child in circumstances where the rights of the child prevail because it is not safe for the child. I don't have to explain all that to any of you here, because we have to make decisions that are in children's best interests and keep them safe and ensure they're educated. But even when that happens, parents do not lose all rights, you know, they're still rights holders. And what we're trying to do, for example, a child, if you view it that way, the child has a right to contact with the parents where that is safe and appropriate. And that is also in the interests of the parents. So they're interwoven and complex, and occasionally there are conflicts, but no one loses rights as such. They have the rights. There might be instances where the rights of the child might prevail over a particular interest. Teachers don't ever lose their rights. The rights that teachers have don't ever get lost. I would say that for sure. Parents might lose a right to have custody of a child, but teachers will always have a right to be treated with dignity and respect. Now, is that challenging to deliver in certain environments? Yes. And if you're interested in conflicts of rights, I have written with a colleague in Australia a paper specifically on this idea of creating contexts where perhaps a child presents with challenging behaviour which is impacting on the education of other children. And I don't know if that's what you're getting at, but I think what we suggest is often that's approached in a way that is really just the rights of the 29 outweigh the rights of that one child. And that is a very basic and misconception of what a human rights-based response to that situation is. And we've developed a framework for taking schools and decision makers through a rights-based understanding of how to handle that, which may end up with that one child not being educated in that classroom. But often there's a straight jump to that without realising that actually not enough has been done perhaps to meet the right of the individual child to inclusive education. But that can be shared as well. It's an academic paper.
I was just saying thanks to Nicole, who did share in the chat the link to the Scotland pledge, infant pledge. So that's gone in the chat for delegates today. Thank you, Nicole. Another question, Laura. How do we support families, children and parents who feel disillusioned with constantly being consulted and never hearing back, or who feel like that it's just a tick box exercise before they even start working with you?
Yeah, I mean, I think that is a very common thing, and that idea of almost something's called consultation fatigue. We've been asked and we've seen nothing, and disengagement, and there is a literature about that with children in schools in particular, the whole school council thing, where often nothing happens, so why bother? And I would absolutely understand that a perspective if that had been the experience, and I suppose that is why I'm really emphasising the new feedback thing. Because a lot of that is just about not being informed and not being told and not hearing back. And it is a breach of the basic principle of the dignity, is to take someone's views and then not tell them what you did with it, for all of us in all of our contexts. So I don't know what you do if you've got already disillusioned parents, other than reassure them. What we would try to do in our own practice is go in saying, your experience in the past may have been, but this is my commitment to you. Whenever you engage with me, I will get back to you. I will get back to you within, 4 weeks. I will do this. I will tell you what I can do, what I can't do. I think it's explaining that and trying to get them on board again, and then modeling it and doing it. Because if you don't do it again, then you've got a very disillusioned parent and child. Yeah. So, I mean, in the children's work, I think it is true. Children can really, and we've seen that there's lots of research evidence about children disengaging in care proceedings and that, and not turning up to reviews because it never meant anything and they didn't get what they wanted. And often they're not going to get what they want because what they want is to go back home, and that is maybe not going to be possible. And I think even in that instance, it's really, really important. And the best example I've seen, that's actually cut out of the slide now. I normally always have it, came from Bez, and a young woman she worked with whenever she developed the framework in Leicester, and it's a woman called Tash. She was one of your care experience council members, and she wrote a little explanation of the Lundy model, I think in a speech she was given. You were launching it, Bez, I think in Leicester one time. And when I got it, I literally had goosebumps when I read it, because she just did this amazing, I'll maybe get it and you can share it later, Bez, I can send you the slide. It's just an incredible summary. But one of the bits that is really powerful in that summary for me is her account of influence, and how in the context of that work, it's even more important to find out when you can't do something, to understand, to be told you can't, and be told why you can't, to be helped to understand it. And it's just a matter of human relationships, isn't it too? And actually what often happens is that they're told you can't live, but not in the context of, you know, the reasons for that explained in a child appropriate or friendly way. So I think it's really important, but maybe we can share Tash's speech at some stage. Yeah.
Thank you. The next question is, it seems to me that to develop good observation skills to implement Lundy well, we need to develop a high degree of mindfulness. Should we be investing in mindfulness training for our maternity health professionals and others in the family hub?
Probably. I don't know enough about mindfulness, but I think it sounds like something. I mean, I know something about it, you know, but I think anything that I think encourages taking time for attentive listening. And I've started to see a couple of really nice listening models. I'm watching them out there to see which ones I really feel kind of fit with the Lundy model, and maybe you can help share that. But I do think there is something about respectful listening, and I know where my own work is. We do a lot of work all over the world with children on lots of things, but including participation. And when we do little exercises of, you know, what makes a good participation, what's not good participation. And the latter, children often focus on listening, and that actually the distraction, the adults are often seem distracted whenever they're meant to be engaged, and that could be the recording the notes, or whatever it is. It doesn't look like you're listening, or worse, they're actually sitting on their phones. But I think in that part of that, and the models that I'm looking at really good attentive listening, there is always that idea, isn't there, of saying back what you think you've understood by it. Because again, what we find in research is say, oh, you mean this? They go, no, I don't. It's like, no, I don't mean that. And actually, again, we make assumptions. We come in with assumptions. So you've got that constantly check with children. Is this what you mean? And I think often a really good technique we have found, I don't know if the rest of you, because we have much greater direct practice with children and families, is by giving examples, to make it concrete. So you've said this, do you mean you'd want to do something like that? And then you can really unearth what exactly it is concretely that they do want. But yeah, I think mindfulness, anything that encourages attentive listening is certainly an interesting suggestion,
Thanks, Laura. And I think Anna Freud would back that up, and maybe there's some scope in exploring our approaches to mentalization and the skills for active listening and overlaying Lundy. So that's a really interesting question, really conscious of time. And we have two very quick questions, if that's okay, Laura. I think one of them Estelle will be able to answer. So around the Lundy participation framework that was shared. So I was just trying to find it on a Google link.
Stick it in. It's really easy to find. It's not the Lundy, it's the Irish National Child and Youth Participation Framework, but it's all about Lundy.
Yeah. So we can share that link. So the final question is there a cost or licensing to use the Lundy model and the forms or diagrams that you might have shared in your presentation?
No, I think hands up to the Irish government. I mean, obviously the original Lundy article is in the British Education Research Journal, which is kind of prestigious education journal, and it has to be cited that it came from there. They have the copyright, not me. But whenever I went to do it with the Irish government, our spirit was always, our vision was Ireland, and obviously Northern Ireland for me, but it's gone worldwide. Everyone uses it. They don't care. No, they welcome it and they celebrate it. They welcome and celebrate it. I think the only thing you have to do, of course, which you would do, is acknowledge the original Burge article to keep yourselves legally right. I'm a lawyer. And the second thing is, from an ethical perspective, is to acknowledge that it came from the Irish National Framework or strategy. No, it has. I am not the Lundy model. I was a conceptual framework, but with the Irish policymakers, including Tusla, who were really very strong in the very first group, that we worked together to create something that was concrete and applicable in practice. And then they've taken it from there, and you can take it from there. You know, Bez has taken it from there. Other people have taken it and improved it, and that can only be a good thing, you know.
Thank you so much, Professor Lundy, for sharing more about your model and showcasing how it works to our work with parents. Thank you. We will now hear from those with practical experience of applying the Lundy model. Our first speaker is Estelle Duffy.
Thanks, Dina. Morning, everyone. Thank you so much for having me. My name is Estelle. I am the Participation and Partnership Officer for Tusla in the Child and Family Agency here in Ireland. That's just my contact details if you feel you want to contact me after this, or you want to maybe have a look on Twitter and see what I'm up to over there. Next slide, please. So who are we? We are a dedicated national state agency. We were established in 2014, roughly around 5,000 staff across the whole of the Republic of Ireland, with around 4,676 full-time equivalents towards the end of 2022. So we work across 6 regions in 17 operational areas and working close to about €1 million budget, and that was recorded towards the end of 2022. And if we could just have the diagram there, please. And what we do is work with everything related to children and families. So that goes right from child protection welfare, across to family support, alternative care adoption, children's regulation services, counselling therapies, and domestic sexual and gender-based violence there, and also the Tusla education support services that looks at supporting the education. Next slide, please. So just a little bit here about how we try to embed participation. We do have a vision and a mission. So because we are a child and family agency, families and communities are empowered and strengthened to keep children safe and nurtured, recognising a child's right to protection, stability and support of a family and community networks. So because we want to make sure that families and communities are empowered, we obviously have to work from a few values and behaviours to help empower them. And one of the ways we do that is by seeking their trust. We will seek your feedback and use it to inform how we improve. And again, linking that back to participation, we want to build an agency that is related to children and families, and that is empowered by children and families, that works for children and families. So again, just to gain that respect from children and families, we will be informed and influenced by the opinions and experiences of others. And that really does help shape how we create policies and how we work with children and families, because again, that's, you know, they're the expert in their own lives. And again, working around that kindness, we will be compassionate in explaining decisions, even when the decision is difficult. And again, looking back at the Lundy model, that's how we try and inform that audience and influence part. And again, we work collectively with our stakeholders to achieve our collective goals. So again, it's not just about what's working for us as professionals in an agency, it's about what works for our children and families that we work with. Next slide, please. So just to give you a little bit of an overview of our response pathways here, we work from very low prevention universal needs. So that goes from anything family resource centres that are part funded by Tusla, early intervention, family support, and our partner organisations, and then it goes right up to anything that's high prevention and on a level of harm that's a need there. And it could be significant harm, it could be an alternative care is needed, it could be something that's determined by the court, and it may be that we look at separated minors, residential care, and we have a lot of supporting teams and services and interagency work across the spectrum to help support us with those. So we do have the health service, we have the police on Gardaí Corner, we have our community and voluntary services, and then throughout the agency we obviously have our HR teams, our finance and commissioning, and everybody tries to work together in a participatory way to make sure that whatever decision is taken, we understand that it will affect a child or family. So that's why we all are eligible, if you like, to partake in the child and youth participation training and the parental participation training, because we are working with children and families. Next slide, please. So just a part of our early intervention, our family support, we do have a parenting strategy, and what that means is parenting support will be available for all parents when and where it is needed, helping them with any challenges they face. And again, that's going back to the spectrum of anybody that is, you know, low level or anyone that is high level and requires early intervention or just requires a bit of support there as well. Next slide, please. So just trying to implement the strategy, we have a number of initiatives that we do with a parenting strategy, and they go from parental participation seed funding, and they go right up to having parenting support champions and a little bit of everything in between. What we're going to focus on today, just for the example of Parent Hubs today, we're going to look at parenting seed funding. And for anybody who doesn't know what that term means or is a little bit unfamiliar with that term, we basically provide funding to support initiative startups. And what we hope is that the startups then get rolled out into the wider community, and they go possibly national, and it's implemented then within every region and within every county. If you just want to click the next slide, I think there's 2 little logos that will come up, and then we'll go to the next slide. Perfect. So this seed funding project example came from soon to be Dr. Caroline Rowe and Dr. Valerie O'Brien. Now, they were looking at supporting the participation of parents of children in care to enhance the experience of access and contact. And the way they did that is by applying for the funding and using the Lundy model of participation to help them engage with parents, to help sort of shape what that would look like, that research. And just as a note, I think if you just press that again, there's another image to come up. What happens is at the end of every year, when the funding goes out to the organisation, they are collated every year into a summary. So everyone that successfully created an initiative, again, sharing that good practice, we like to share the learning that's available in a document that's on our website, which I will share later on. Next slide, please. Okay, so how is the Lundy model used in parental participation? We know Professor Laura Lundy gave the 4 quadrants there, and they are put into kind of a circle model. And when we're talking about this model and we're talking about having the space, the voice, the audience, and the influence, I do like to use the term bringing it full circle. Like, can you bring this full circle, just because it is in that circle shape there? And it's more about, if you provide that space and you have, you know, you choose to get a group of parents together, they're in an access room or a very safe feeling room, a community centre, whatever's comfortable to them, and you then are expecting the voice, sometimes it might not come straight away, and that's okay, because providing space can change the experience for parents and gives them hope for change. You're basically saying, here we are, and we're going to listen to you, and we're ready when you are. And what you might find is that voice doesn't actually come for 6 months, a year, but right at the very end. But again, providing the space in the hope that a voice will come, or again, like Laura was saying, it's not always a physical voice, it's about expressing themselves or expressing the views. And however means that may be, that could be taking a group of parents out on a photo hunt for the day. You know, you give them kind of like a bingo card, they take a camera, you're asking them to go and find certain things. And again, it's starting those conversations, it's starting to express themselves how they want. And that does contribute towards the feelings of being heard, being valued, and being respected. So again, it might not always come naturally, but again, another term I like to use is to let them grow it organically. So these things have to come organically. You can't force these things. And like Laura was saying, you can't always expect a voice will come. It's not a demand. It's, you know, it's their right to express themselves. If they want to drop out halfway through the participation, that's absolutely fine. If they want to attend 6 sessions and not express any kind of interest until the 7th session, that's absolutely fine. But what you find is when you continue it, when you persevere, and you are the audience, you provide that platform for involvement in other participation projects and new learning. It could be that on the 4th session, one of the parents turns around and says, I think we just need to go out for a coffee and, you know, not really focus on this like nitty-gritty policy that you're asking us to look at, or, you know, can we just go and sit in the park for a little while and just gather our thoughts? And again, for you to be that audience, you're actively listening to them. It provides new opportunities for them to be heard and feel like they're being heard. And again, if you're going to bring it full circle, what is that influence? You know, if you're going to be acting on those views, you're providing opportunities to inform service planning and for services to be better responding to their thoughts and their feelings and how they interpret their interactions with an agency like ourselves, or with yourselves as the agency hubs over there. Again, bringing that full circle provides that influence for them. And again, if you can bring it full circle, you're actually providing all of those quadrants, and you are making it grow organically. You're responding to their needs at whatever level and whatever time it takes. And again, just to kind of reiterate that point that Laura Lundy was saying, that the voice is not enough. And we know the voice is not enough because, again, it's something that can't be forced and it can't be on your time scale because life happens for a lot of families and for parents. And, you know, we have unprecedented cyber attacks or COVID outbreaks or, you know, life happens. So we can't always put a time frame on these things. Next slide, please. So how did we achieve parental participation in the example we're going to talk about? What we wanted to look at was how can service planning and delivery in relation to access and contact be improved through parental participation? So we know that we wanted to look at how we could improve this for birth parents that had children going into care. What we wanted to do was obviously consult with the parents. We wanted to consult and engage with them. And again, engaging could be just providing that space. You wanted to engage, build up a relationship, build up the trust. This was done in the Midwest area of Ireland. And again, you have to do it in a meaningful way. You have to be very careful and very sensitive about these things. You want to gain a greater understanding of the barriers, but also the enablers of participation when you're talking around access planning. It could be that the access for some of these parents just wasn't suitable. We know a lot of parents simply want to sit down and make a hot drink with their child. They want to make a cup of tea. They want to make it feel like it's a home setting. And again, sometimes in a community centre with a table and a couple of chairs just isn't quite right, that feeling. So again, things like that are looked at. Can we make a sofa available? Can we make a plant available and a little side table? Can we have a small kitchenette to enable these parents to just make a cup of tea with their families? We obviously need to increase the parental awareness and the knowledge of their rights, which is then fundamental to the children's rights to access. So again, when we're talking about things going hand in hand, we obviously need to understand, yes, we know what children's rights are and we know what parents' rights are as well, but we also need to make sure that they go hand in hand. We also need to understand that the children's right was to be safe and protected from harm, and that the parent also needs to understand that and what they need to do for the next step. And that's how we work in partnership with parents. We develop the locally based information materials in relation to access. So because this was done in the Midwest area, we needed to look at what was available in the Midwest area. There was no point in saying, well, look, we know what's available in Dublin. We know what's available in the Northeast, the Northwest. It's not going to work for the parents in the Midwest. So we worked in partnership to develop all of that information. It's what the parents were asking for. How can we understand how our access works if we don't, if we don't know these things? And I think there's just one more image there to come up. Again, yeah, working with the parents to improve their ongoing participation with a view to informing decision-making and system change. So again, if you're going to find decision-making a part of the process, if you want to have a view of informing change, and you've got to take all of these steps, you've got to build that trust, build the relationship, again, using that term, bringing it full circle, making sure you have provided that space. And then if that voice hasn't come yet, keep working on that space until the voice comes. If you can't really do that influence, if you can't make those changes just yet, again, work on the voice and work on the audience piece, making them feel comfortable. And then the outcomes of that, if you just want to click the next image for me. Sorry about this now. So some of the end products, because we achieved all of those objectives, the end products is that we had participation by over 40 parents, which was absolutely amazing. From that, we comprehensively researched a summary and a report from the research of those parents. Again, then we were able to provide a resource for parents, an actual finished product. There is a short video that I'm going to play next, and it's of the voices of the parents that have the children in care. And then finally, we did want to disseminate those findings to all Tusla staff and to the relevant support agencies that we work with. And again, bringing that audience influence piece into play. We want to share that good practice. We want to show what we have done, how it can be replicated, and what we can use going forward. Next slide, please. So this is just a little clip here. You can access this clip if you like. It is 10 minutes long. I'm just going to play the first 5 minutes. Thank you.
I can remember at first it was very hard.
I found it very tough at the start. I was on supervised access. I was basically fighting addiction and I was fighting against the social workers at the same time.
When my child went to care, it is hard, it was hard to let him go. Because you feel upset and angry and You know, you feel hurt, like. Well, I felt that I let him down.
It's kind of overwhelming. So you try and buy them loads of presents to show that you love them, you miss them. But in my case, I had supervision order with me. So I was supervised every time I met my two kids. It was in a coffee shop, and my son, he wanted to go to the toilet and I wasn't allowed to bring him. But the social worker brought him in because I wasn't allowed, and that kind of stripped a piece of me away.
You put your head in the sand. It's so hard to face up and admit to the fact that the reason that your child isn't with you is because of your choices and your decisions. And it takes a long time to be able to get the courage to face up to that. And that's why it's so hard at the start.
I was frozen, I couldn't talk, I was like a mute. I used to walk with my head down. Couldn't smile, couldn't look at people, and it's like I had no voice. I wasn't me anymore. I wasn't a mother. I wasn't a person. I was a disappointment. I was ashamed. How could I do this?
I used to cry. I used to leave every time crying. After every visit, go for a walk for 20 minutes by myself, just to clear my head. There was certain songs that I'd listen to that would help me. I had to find something that would help me afterwards. I felt like I was being watched. It was like I was on Big Brother. I couldn't be natural with him. If you're not natural with your child, that's going to affect them in the situation. And then eventually you move on to the stage where you actually start to feel comfortable and natural.
At the end of the day, it's still going to be our child or children that you're going to be spending time with. Just think it's yourself and the kids in the room or whatever. The person that's supervising it at the back of your mind, and not to be nervous. You know, you will be nervous. I was at the start, but then I've got a great communication with the people that do the access and stuff. Just don't be afraid and just spend time with your kids.
I started to get counselling, and instead of being shut down so much, I had to work at it hard. But I got back up on my feet and I realised, yeah, I might go down a few steps, but I can come back up another few. I kept building from there. It got easier when I started getting stronger in myself and getting my own confidence back. And my kids could see the confidence coming back, so they worked with me. And the more we kind of bonded, we were like the Three Stooges kind of thing, and things started getting easier and we started kind of fell into place then. It became a routine. I was lucky that I had once a week for 2 hours, and then it started gradually building up twice a week for 2 hours, and then it went up to 3 days, and then it went into overnights, and then it went into shared care near the end. I had good access in a way. I had phone calls whenever I want, and I collected him after the supervision stopped. I used to go up to the school and meet. He was happy as anything coming out and see his mum standing there.
When you lose your kids, your life gets torn apart, it's broken. You have to start putting this jigsaw puzzle back together. And you need to get this jigsaw puzzle built back up piece by piece. You can't be there for your child unless you put yourself first sometimes. I had to put myself first, and I wasn't being selfish doing that. I had to build myself back up so that I could be the parent that my child needed. So I had to take a time out for myself, do that, and get to the stage then where I'm able to be there for my child because I'm fixed myself. Now, I'm not 100% because I'm human and nobody's 100% fixed, but I can be there for both my children better now because I'm a better person.
Fantastic, thank you. And I hope that kind of demonstrates how when you put the time in and you put the effort in with the parents and you spend all of this time letting it grow organically, providing those 4 quadrants of the model, the results that you can get. Now, obviously, that's a very powerful piece, and it was a very long piece that took a very long time to produce. But again, being on the other side of it, being the professional, being the person that is there, showing the support for the parents, making them understand that actually, as an agency, we are here to support you, no matter what your level of need is. we are here to support that. And from that came the next slide, please. The actual piece that they wanted to produce in the end. So we had that to share with professionals, and it's there in the public domain to share with other parents and yourselves. And then we have this piece also, which is the information guide for parents that have a child in care, and it goes through everything there. So anything sort of like decisions about my child, who makes them, my parental rights, court orders, what does that mean? Voluntary care, what does that mean? And again, I suppose it just, when we look at using the Lundy model to produce this, how did we do it? You know, just the 3 little points there. We worked collaboratively with parents of children in care and supporting participation. We supported the participation. Of course, none of this would come without their involvement. Improving the experience and quality of access for children in care and their families. So if the parents came to us and said, you know, the access room I'm using doesn't really feel very good, I don't feel like it's access, I'm just in a room with my child, can we make it a bit more home friendly? Again, that was something we worked on, that participation piece, and then undertaking collaborative research in partnership with the parents of the children in care resulted in the piece you've just listened to. So I hope that was a little bit of a whistle-stop tour, but I hope it gives you some information as to how we use the Lundy model in participation, and especially with parents. And I think that's the end of my slide. Is it the next one? Thank you. So that was me.
Thank you so much, Estelle. That was really informative and quite moving, actually. Our next speakers will be Vasha Patel and Rakhi Varia, Rights and Participation Officers from Leicester City Council.
Thank you, and thank you for inviting us to this amazing webinar. My name is Rakhi Varia. I'm a Senior Rights and Participation Officer for Leicester City Council, and I'll let my colleague introduce herself.
Good morning, everybody. I'm Vasha Patel, and I'm a Rights and Participation Officer.
Thank you, Vasha. Our presentation will give you a snapshot of how we do it at Leicester City Council. Next slide, please. So as a local authority, we use a number of frameworks, approaches and legislations to anchor our commitment to participation. We continue to have a senior leadership buy-in to use the Lundy model as an approach to participation, and this is outlined in our strategy, which covers the children's social care, education and early help department. Sorry, can I just have the previous slide, please? Thank you. As Professor Lundy mentioned earlier, we do promote young people's involvement and participation through creative methods. The posters that were shared earlier are distributed all over our department as a reminder of our approach and our vision. Leicester has invested in a strategic lead and a designated team to deliver, train and champion good practice in participation. The team has grown and developed over time. We have 2 senior rights and participation officers, 4 rights and participation officers who deliver on different streams of participation, including with children, young people, parents and carers. One of the key areas of our team is training and development of participation and the Lundy model within our department. Our aim is to ensure everyone in the department is trained in the Lundy model. This includes our new recruits within social care. We use the Lundy model principles in our recordings and in our language in our everyday practice. We do emphasise on the 4 elements within the Lundy model and share practice in each area and how it strengthens their delivery. This is once again underpinned by the Article 12 of the UN Convention of the Rights of the Child. Leicester City Council works towards a relationship and a strengths-based approach to listening to children, young people and families. It is aligned within our other approach, which is the signs of safety approach. And this allows us for a cultural shift and a shared understanding in not only how we listen, but how we ensure that those that we work with know their rights and are afforded the opportunity to shape decisions and services that affect their lives. Through our advocacy and children's rights offer, we are working closely with other professionals within social care, and it is so lovely to see the shared understanding and the cultural shift when we are working with children, young people and families. This is also noticeable within our recording on impact and outcomes, measuring impact and outcomes. Next slide, please. I'll pass you over to Varsha. Thank you.
Thank you, Rakhi. Well, one of the new strands of work which we are trying to drive forward is the Family Hubs and Start for Life programme here in the city. And many of you will know that's not only just for focusing on the first 1001 critical days of a child's life, but also for children and young people up to the age of 19 and obviously up to the age of 25 years old for children and young people with SEND. And we've been kind of driving this, the new programme for about a year now here in the city. And what we've been trying to do is work in partnership with various organisations to ensure that Family Hubs support families to access services and advice that they need from right through from conception through to early years and the start of adulthood. And these partnerships and relationships that we've been talking about all morning from colleagues from public health here in Leicester, social care, the local voluntary and community sector, which is very vibrant here, is going to be so important when we move our agenda for Family Hubs forward in the city. Next slide, please. As I mentioned, we've been working on Family Hubs for the last year or so, and we've established different work streams to help us do that. We have a strategic board who have an oversight on the different aspects of Family Hubs, working together with a delivery group who monitors 5 specific areas, and you can see them there on the slide there. We have comms, communication and digital aspects and visual platforms that we are trying to develop to ensure that parents and carers will have access to the vital information that they need. And Raki will be kind of talking to you about some of the brilliant work that we've been doing with some young people groups around our branding very recently. We've also got other areas of work around workforce and obviously our physical estates as well, which are going to be very important as we bring forward the Family Hubs agenda. But obviously one of the areas of work that we are keen to kind of drive is around participation and community engagement. And in particular, some of the work that we've been doing in trying to develop parent and carer panels, as well as working with existing peer networks, which is really important. We are at the early stages of developing those, but we'll talk you through some of the work that we've done. And at the bottom there, you can see that we've also got some specific provisions like home learning environment, parental support, parental infant relationships, and infant feeding as well, and the Start for Life offer, which we've been working on most recently. And those specific provisions will be kind of delivered by our cluster managers within our young people and family centres. Next slide, please. I'll hand it back over to Raki.
Thank you, Varsha. So as Varsha mentioned earlier, one of the strands and areas of work that our young people were involved in was the logo and branding of the Family Hubs. So we provided the safe space in which young people actually agreed where they wanted to meet by arranging an initial briefing session with our heads of comms at a picnic in the park, in our local park. We arranged creative sessions then at our local arts providers who specialise in supporting young people's understanding of the context and to create opportunities to share their ideas in different and creative ways. This is how we heard their voice. The audience was the corporate comms team, the project lead, as well as our directors. And the influence was the outcome of the logo and the branding, which you can see dotted across the screen. Next slide, please. So as Professor Lundy and other colleagues mentioned earlier, feedback is so important. So what we did was we created the comms team, created feedback to share with young people so they could see how their ideas had informed the final branding and the logo. The feedback aspect of participation, like I said, was so important. We do always try and ensure young people, children and families are informed about how and where they have had an influence, or any explanation given to them if they've not been able to influence any aspect of their involvement or request. Thank you. Next slide, please. Varsha, over to you.
Thank you, Raki. So one of the early pieces of work that we did in terms of participation and engagement is trying to develop a parent and carer forum within our Family Hubs. And initially we started to have discussions with partner agencies as stakeholder briefing, which we had a number of months ago, where we invited colleagues from public health who we work very closely with. As I mentioned, our vibrant voluntary and community sector, our community and library services, as well as existing and established parent carer groups, and which helped us, that conversation that we had in that stakeholder meeting really helped us to identify who we can consult with, which including parents, teen parents, first-time parents, fathers, and even working with our Gypsy and Traveller communities as well. Another strand of work which we did working with our teams within our children and young people centres is that we carried out initial conversations with parents who attended sessions at our children's centres, and that was through our Stay and Play and Have Your Say sessions, which we hold once every term. And again, from those conversations that we had with parents and carers, we got initial interest from groups of parents who wanted to be involved in the Family Hub Parent and Carer Forums. And I'm really happy to say that we've had a number of meetings now with the same parents, a consistent group of parents who have given their time and support. And what that enables us to do is build a professional relationship with them. They get to know us and we get to know them. And it helps us to capture their voices as we're consulting with them of how we're going to pursue the Family Hub's agenda. And one of the things that they have been developing, we've been working with the Parents and Carer Group, is a flyer for Start for Life. And we took an example to the parents, and the audience is really, really important when we were doing this piece of work. We had to capture the voice of parents and teen parents whose children were under the age of 2, so they could give us the feedback of what they wanted in terms of support for themselves as well as their babies. Obviously, the voice was very important because they could give us their first-hand experience. Their space, when we're trying to develop the Lundy model with this, we looked at the space and what was going to be comfortable, not only for the parents, but we had parents bringing along their babies. We had a 6-week-old baby come to our first session, and we had to ensure that the space was going to be good for them and the environment good for them. And the influence, we've talked about influence all this morning, and what's really important for us is to be very clear about what our parents and carers and our young people can influence when a consultation is brought to them. And that's where we had to work with the project team to make sure that we were very clear about what parents and carers could influence in terms of this flyer. And the overall impact of the work that we did with our parent carer group, with our Start for Life flyer, was that they've delivered a brilliant piece of work which we'll be launching in the next couple of weeks in terms of our summer offer as well. Next slide, please. As you could expect, with a new area of work, we have had a number of challenges to consider. In particular for us as a team, we are a small team, and we had to actually have a look at our kind of capacity, which, to be fair, we didn't mind because we love working with parents and carers, and we do that as part of other groups that we lead on. We also had, in terms of relationships, we had to be very clear to all of our partners that as a team, on a day-to-day basis, we don't necessarily work with parents and carers. And so this is where we had to go back to our networks with our children's centres, colleagues from Youth Justice, our youth workers, who were best placed to identify parents and carers who can join us on this journey as being part of the panel. And like any new programme, we had timelines that have changed at various times, and we've had to be very mindful of that, mindful of the impact it has on our team, but also mindful of the impact it has on parents and carers that we're working with. And again, just to kind of mention the realms of influence, again, that's very important to us as a team, that when we work with partner agencies, not only on family hubs, but other aspects of work, that we are very clear about the realms of influence that young people, parents and carers have, and to ensure that it's not a tick box exercise. The other challenge that we had was logistics with our city, really, and making sure that we have the right space. You know, we're very limited on the venues that we have here in the city, but we also had to consider transport links for our parents as well to ensure that they can get to one venue to the other as well. So that's one of the other challenges that we had. And we can't go away from mentioning quality and diversity. Many of you know that Leicester City is incredibly diverse. We're very lucky to have the range of communities that we work with. And for us, we are always asking questions as we are developing family hubs within the city, is how best we consult and engage with different community groups. And we're looking at different ways in which to do that, not only through a digital platform, but the face-to-face contact that we can have as well. So we're always keeping that in the forefront of our minds. Next slide, please. And our solutions. So obviously we had to kind of go through and work through some of our solutions to those challenges. We are very fortunate that we had one rights and participation officer, including our senior rights and participation officer, working with our project team around family hubs. We've also been incredibly lucky to have the funding from family hubs to approve and recruit one full-time Family Hub's rights and participation officer for the next 18 months. And we're really excited about that because we have got some ideas of how we're going to develop the parent carer groups as part of our Family Hub's development. And we're really excited about that appointment. We also have our service manager attending regular sessions, not only on a strategic but delivery aspect. And as a team, we also have to identify and include monthly reports backs, which includes risks that we may kind of have and challenges that we have. And we also have officers that go to fortnightly strategy meetings as well to make sure that we're looped in to all the progress that we're being made in terms of the Family Hubs model as well. Next slide, please. And we didn't want to go away without mentioning what we do practically. And I think certainly Estelle kind of mentioned some of the evaluation and planning models that they use, and Laura did as well. We meet our parent carers every 6 weeks or so. And we also have, and we've kind of modified a planning and evaluation tool, which we have with our young people groups, which we've used for our parent carer sessions. And I know that you can't see that very clearly, but the coloured boxes are linked to the Lundy Model and all the aspects of the Lundy Model. And we have key questions that not only we ask ourselves as a team in the planning stages, but also the evaluation stages, and getting our parents and carers involved in that feedback as well in terms of our evaluation. And Bez, I think that is it from us. Happy to take any questions. Thank you.
Thanks to you both for your presentations, and again thanks to Estelle who went before you. I'm really conscious of time, so we're going to ask and hand over really quickly. There's lots of comments and questions in the chat, and so thank you to everyone, and we don't want to ignore them. A question to all of the speakers, Estelle, Raki and Varsha. Can you please give some suggestions and recommendations for engaging parents and caregivers who often don't participate in co-produced activities? How do we best reach out to them and support them?
I would say it's all about, again, handing that empowerment back over to the parents and caregivers. Sometimes an informal chat of what would you like from us? Sometimes a coffee morning doesn't always go down well. Sometimes it could be, shall we go for a sit down in the park? It could be, again, asking them what they want out from you. What do they want out of any of the sessions? Is it that they don't really want to do the activities? Is it, you know, myself personally, if you're invited to something that doesn't really suit, are you going to turn up? Or if it is something, you have to make sure that you turn up regardless. So even if you invite 100 participants and you get 2 responding, you stick with those 2 responding. You show up and you make sure that you're there in case anybody else wants to turn up. So it's all about being that professional, but being that person who cares. So again, if you're going to organize a session, I'm going to be in the park at 10 a.m. Come along if you want to. We're going to have a cup of tea. We're going to have a chat. We're going to have a couple of sandwiches. And it's just to kind of see what you want to get from us. You might get 2 people show up, but I guarantee you there's another 2 around the corner watching to make sure you said you were going to do what you said you were going to do. So you will have those people that will be testing you, because as always, even with children, you're just another adult in their lives. You're just another person who says they care, who says they're going to fulfill something, and they want to say, are you going to do what you said you're going to do? So if it's something that you're going to set out and plan and follow through, make sure you follow through, is my best advice.
Thanks, Estelle. I don't know, Varsha or Raki, if you have any further comments to add to.
I think certainly, I think, Estelle, all of the above what you've mentioned, but I think we can never underestimate the time it does take and the commitment that you have to give in terms of building those trusting relationships, and you have to do that in bite size. So I think I would say give yourself time to do that, but all the above that Estelle just mentioned.
No, you're so right, Varsha. Yeah, 100%, Varsha. I couldn't agree with you more. Those relationships can take any amount of time, and that's the most important thing. You're so right.
Yeah, and for us, it's also about, let's go to where our young people or our families are, instead of expecting them to come to us as well. So that always helps. Thank you.
Brilliant, thank you. And there's lots of commenting on both presentations, asking for sharing of contact details to reach out in terms of sharing good ideas and sharing some learning. So I'm sure you give consent and you're happy for us to connect you with those delegates. So thank you for reaching out in the chat, asking for that. Varsha, someone's asked who'd be really interested to talk further around your Gypsy and Traveller work that the city have done. So hopefully you will be able to share
not a problem
details there, and people asking just to again to share good practice. A quick question: how did the length of time families were involved with you in Leicester affect their engagement? They're in a position of trauma sometimes when they're involved in services, and can give better feedback and engagement after a period of reflection and objectivity.
Yeah, I mean, we've just started our parent and carer forum within Leicester, probably the last 6 months, and I think for us we've been incredibly lucky because we started off with a group of 20 parents who put their names forward, who are interested in family hubs, and those parents have stayed with us, and like I said before, we took the time to build our relationship with them. In our first meeting, we probably didn't talk to them about family hubs and what that was going to look like. We wanted to just build our relationship with them, and we've took the time to do that. So we're kind of 6 months in now, into probably our 5th meeting with them, and now we're starting to talk about the nitty-gritty of family hubs and what they would like to see as local parents and carers. What would they like to see in terms of the services that we can provide? So we've done it in a gradual way in Leicester, and we're still building that, Bears. It's going to take us time. It's going to take us time to develop those groups. And like I said, I think one of the challenges that we've had is to consult with dads, because we don't have a dad in our group at the moment, but that's not mean that we're going to forget them. We're going to have a look at different ways in which we can consult with different groups in our city.
Thanks, Varsha, and I agree with Toby. There is an element of stability that is needed when engaging with particularly vulnerable families and asking them to sit at the table with decision makers to shape services. And if we were to overlay Lundy, I suppose, onto that, that's where the creation of space really plays into its own around trauma-informed practice. Quick question is around structuring your parent and carer panels in terms of themes and topics for discussion. Is this now being shaped by participants that you're working with?
It is, yes. I mean, in our last meeting, parents wanted to know a different aspect of our Start for Life offer. And so very much so the feedback that they give us in our sessions, we leave time at the end for parents and carers to tell us if they want a specific, to talk about a specific aspect. In our next meeting, we're going to have a senior manager go along to the sessions because they want to know about the full development of family hubs and not just the Start for Life. So they're very much involved in everything that we do, actually. They're a strong voice, and we're lucky to have very confident mums in our group who are ready and willing to ask us anything, really. So we're very fortunate to have them and work with them.
Okay, thanks, Varsha. That's brilliant. And there's lots of requests for sharing of some of the resources that you've talked about today, and likewise, Estelle, and any sort of research that's underpinning some of the evaluations of projects that we've shared. So we will make sure we will pick that up. So can I just say thank you to all our speakers, Estelle, Varsha and Raki, for joining us, and to everyone for the questions. We will make sure we pick up the comments around connecting people who've asked to be reached out to any of our speakers. We have now gone past 11:30, so apologies for that, but we felt it would be nice to include at least some of the questions in the chat to our speakers. And I just want to say again a big thank you to all our speakers, not least forgetting Professor Lundy, who joined us first thing, for a really, really interesting session. And thanks to all our audience as well for taking the time to join us today and for sharing your questions and your comments in the Q&A tab. At the end of this webinar, you will be redirected to a survey form. Please do fill this out. It's really important, and we appreciate all feedback, and it will be used to shape upcoming webinars that we will produce. So please take time to complete that and send it back. And just a reminder that you can sign up to our Family Hubs in Mind Learning Network to receive our newsletter, which will give you information on future events. Can I thank my co-host Dina for being amazing. And again, lastly, thank you to everyone, and see you all again soon.
Thank you. Bye-bye.
Bye.